There's a gentleman now that has been diagnosed with HIV. He was tired of the medication. He was tired of the family dynamics and friends. And he told me that, he said, Blue, I'm not taking my antiretroviral medication anymore. I have just had it. I'm done with it, And I told him, if you don't take your health seriously and if you don't take your medication routinely, then you're not going to be here. Well, it is what it is, and I want you here. That's why I'm here, so that you can prolong your life and enjoy it, and know just because you have HIV, that doesn't mean your life is over. It's only just begun. A couple days later, he called me and said, hey, Blue, you're right. I just picked up my refills at the pharmacy and I took my pills. Are you happy? I said, no, are you happy? And he said, I am. And he said, thank you for the push.
Very much into the DNA of Apicha is the belief that advocacy should lead to service.
We're contributing towards the well-being and positive health outcome of an entire community.
Most of the staff that we have at Apicha relates to most of these folks, most of these people, because we do have the same experiences.
A lot of the staff there not only identifies as API, Asian and Pacific Islander, but we have multicultural staff, and a lot identify on the LGBTQI spectrum.
We see you, right? We see the struggle that you go through. We know you because we come from these same communities.
Apicha is the first workplace where I finally was not the odd one out. I finally belong.
There's a lot of people out there that go to other care management agencies and they don't feel so at home. Apicha kind of invites and allows that. They make it easy for you to talk about your sexual orientation. It's a good way to start the conversation and kind of let them take it from there.
And it's important for a client to feel safe, to feel that they can trust everyone who's involved in their care. One time I was talking to a client. They told me that they think they're trans. For the first time. This is the first time they were opening up. This was the first time they came out as trans. And it was just a very heartwarming experience because, having someone open up to you like that, having them feel safe around you, it's nice that we have this facility that provides that kind of safe space to people who are scared. When I suggested for them to come out to their provider so we can get all their needs covered, and they did. Now we know what's up. We know what's going on.
I think our patients want to be healthy and comfortable with who they go to for care.
We have become a vital source to the community. People feel that we're there as a source for them and they're not going to be turned away.
We have a whole community access to care, not just primary care, but access to medical insurance, SNAP benefits, mental services, pediatrician, dental, women's health is a big one too.
I had an instance where a gentleman was applying for SNAP and he actually had SNAP already. Sometimes it's very difficult for individuals, especially the specific population of homeless and LGBTQ, undomiciled. It's very difficult for them to operate the HRA system. So being a SNAP navigator, I get to just kind of reassure them. So with this particular individual, he knew he didn't know what to do for SNAP. We went into his account, we were able to see that he had $90 in SNAP, and the look of joy on his face where he can buy food is the most rewarding thing I've felt in a long time. To tell someone to go get something to eat is incredible. It's really amazing, and the look on his face, it's something that I'm actually genuinely proud to do. Like, hey, how about you go get something to eat, go fill yourself, because if you're not eating well, you're not living well. These are people's lives.
Not only just a clinic, but now a family towards the community.
It's nice that we have Apicha, this facility, this agency, as a safe space for people who are, marginalized, and people who are underserved, and people who are scared to come out. We're like a family, that you have a team that supports you.
We need each other. Sometimes I need to be pulled and pushed. And sometimes I do the pulling and the pushing.
Because of our ability to show that capacity for compassion as well as services, we have been able to prove that through hard work, honesty, and really a very deep sense of mission, we can succeed in helping our community.